Welcome to the Ask the Expert session. My name is Carla Bundick, Director of Business Development at SmithLife Homecare. I'm here with our honored guest, Dr. Loving Andre, mobile podiatrist with Loving Hands Podiatry. I'll introduce her more in depth in just a moment. I would like to mention that SmithLife Homecare Ask the Expert series focuses on providing valuable information and resources to our community while helping them age in place. We are a sister company with Charles E. Smith Life Communities, another trusted brand for elder care in the community for over 110 years. We serve the Washington, D.C. and Montgomery County areas. We're excited today to discuss the many ways that Loving Hands Podiatry helps older adults in the Maryland and Washington, D.C. area. Welcome, Dr. Andre. It's great to see you again.
Good morning, and thank you for having me.
Sure. Dr. Andre, can you tell us a little bit about yourself, where you're from, and what sparked your interest in podiatry?
I am originally from Albany, New York, born and raised. After podiatry school, I actually practiced there for 5 years. I moved down to the DC metropolitan area in 1991 and started all over again from scratch. When I was in college, I graduated from the State University of New York at Albany and joined the Pre-Health Club. As part of the Pre-Health Club, it was imperative for us to share the different realms of health science professions to the students at the university. So I invited different colleges to come in, and they presented the career fields. Podiatry, at the time, I was a senior in college and I was planning to be an optometrist.
Oh.
I stopped by the table of the person representing the podiatry school, and he said, well, if you're considering optometry, you might as well consider podiatry. And I did not see the correlation there. However, being an open-minded person, I decided to investigate podiatry, and I saw the various different specialties that podiatry had to offer. When I was in college, we went out of the clinic into the community. And it was at that point that I decided to make house calls. Being in the community, going to senior centers, going to health fairs, seeing people where they live was definitely a pleasure to them. And one of the things that they said to me when I was on my interview was that 90 to 95% of people will feel better after your treatment than before they came to see you. And I have found that to be the case in my 38 years of practice.
That is wonderful. Thank you so much for sharing that story. I'm always interested in how physicians choose their specialty, and it sounds like it was just a very natural transition for you to what you do today. And I didn't realize that connection with optometry and podiatry. So thank you for that. That's quite interesting. Can you share with us what the primary role of a podiatrist is in your daily practice?
Mostly I take care of people's nails. It's amazing to me how painful a person's nails can be and how having nails that are pain-free contributes to their quality of life. I have seen many hospice patients, sometimes hours before they passed away, and the only thing they wanted done was having their nails done. I had the privilege of being at the bedside of a dear friend who died, and one of the last things I did was take care of her feet. So just having someone massage your feet and trim your nails and make sure that they're not growing in or have any diseases or infections underneath them is definitely a blessing and a benefit to what I do on a daily basis. I also have the opportunity to take care of people who have ulcers on their feet. An ulcer is an area that has broken down in the skin, and that is usually due to either and poor circulation or a person being bedridden and not moving about as they normally would. I took care of this lady, well, several people in the course of my practice, but most recently, a lady I took care of from December to March when she passed away. She had 11 areas on one foot that needed to be treated.
Wow.
And I took care of her every single week for about 4 months until she passed suddenly, because I had seen her maybe 2 or 3 days before she passed. And by the time I finished taking care of her, she was down to 4 areas.
Wow.
So it was a blessing to be able to take care of her, and the family was definitely appreciative. I took care of another lady who's been bedridden for many years, and her heel had really disintegrated. And I was able to twice, well, actually 3 times, she broke down and restore her normal skin again via the use of lasers and debridement. So it's just a blessing to see people go from a disease state to healing, a healed state.
It really is a blessing. It's nice to hear these stories. They're all different in each way. My mother was in hospice, and I do remember that the last week in life, I remember how important it was for her just to have a little bit of comfort with having her toenails and just having a massage on her foot. But there was always a podiatrist on a regular basis. She was also a diabetic. So, and I could just see the difference in her demeanor. She lightened up. When your feet feel better, and that was the case for her. So appreciate those stories. Tell us a little bit more about your practice and what makes it unique in terms of the services you provide.
My practice is completely mobile, meaning I do not have an office setting. So I see patients who are bedridden. I see patients who are not bedridden, who just have a difficult time maneuvering due to Parkinson's, or the fact that they may have a wound on their foot. It's easier and more convenient for them to be seen in the comfort of their home. I have 3 lasers, as a matter of fact, and I use them for nail fungus. I also use them for healing wounds. I use them for plantar fasciitis, Achilles tendonitis. Another personal story, a couple years ago, I fell in Baltimore. I broke my wrist, and I was in a cast for maybe 2 days. And then I was in a mobile cast. I lasered myself on a Wednesday, and I needed to work. So I gave myself a few days of laser treatments. And by Monday, I was able to see patients once again. And I did wear my cast when I wasn't seeing patients, but at least I was able to resume working after treating myself with laser therapy.
Very nice. Nice benefit to being a doctor who can treat herself.
Exactly. And when I went back, just to follow up with the story, when I went back to see the orthopedist, he was amazed at how quickly I had healed. The other unique therapy that I offer is synexus therapy for neuropathy. People who are diabetic, who may have had an alcohol problem earlier in their life, may have developed neuropathy, which is nerve damage. Your nerves have actually died in your skin. And what happens when a person has neuropathy? They fall. Those falls could lead them to the hospital. They could break bones. It could be a downward cycle and increase rapidity towards death. So neuropathy, definitely treatment for neuropathy adds to a person's lifespan and quality of life. A person may have to stop driving because they can't tell whether they're touching the brake or whether they're touching the gas. And they could cause many accidents, not only injuring themselves but injuring others. So having this unique treatment that is non-invasive, that does not involve any medications that cause other side effects, is a wonderful adjunct to my practice.
That's wonderful. You mentioned that you go to homes. Do you also go to assisted livings, nursing homes? What's your scope of practice as your outreach?
Yes, I was actually able to go to a nursing home in Crofton yesterday.
Mhm.
I was sent to treat one person contacted by the family member, and then the other roommate wanted to be treated as well. So she reached out to her sister, who approved the treatment, and she was so happy. And the sister was so gratified. She was very emotional that her sister was able to be treated at the same time.
Very nice. It wasn't even word of mouth. You were just right there, and the roommate saw it and said, I want that.
Exactly.
Do you accept insurance? How do people pay? Medicare, Medicaid, private insurance, private pay?
I took insurance for 30 years.
Mhm.
And because of the complications and changes in the insurance industry, I have not taken insurance for the last 8 years. So people are able to pay via Zelle, Cash
Mhm.
App, credit card, debit card, cash, or check.
Okay, very good. Thank you. I think you answered this. I was going to ask you about the most common problems that your clients and patients see with their feet, but we kind of talked about them. Anything else that comes other than what we already discussed? Common problems with seniors?
A very common problem is ingrown toenails. And
Mhm.
that is when the nail actually grows into the side of the skin. Some people wait too late and it
Mhm.
actually develops a secondary infection. It could develop proud flesh, which is actually a granulation tissue around the borders of the nail, which is a big red tissue. So I am able to do nail surgery at bedside and
Nice.
give them the products that they need in order to treat them at home. And they usually heal uneventfully within 7 to 10 days. Also, I see with arthritis,
Mhm.
people have bunions and hammer toes and just painful feet. So, laser services are really good for decreasing the pain that people experience in their feet. Also, as we age, our fat shifts out of the bottom of our feet and our metatarsal heads become more prominent, leading to corns and calluses. So I also offer orthotics for whether they're customized or over the counter, podiatrist supplied orthotics to give them comfort when they walk.
Very good. And how do customers typically find you? What's the best way to contact you, Dr. Andre?
People find me via referrals from nurses,
Mhm.
from their social worker, or they find me online, lovinghandspodiatry.com.
Wonderful. Is there anything else we haven't covered that our audience should know about?
I really enjoy going into people's homes, taking care of whether it's the elderly person, sometimes a person may have ALS or MS, so they're a little younger. I've seen people, I think my oldest patient was 108.
Oh,
My
wow.
youngest patient was a year. So I see the lifespan of patients. Anyone can have a podiatry issue at any point in their life.
Mhm.
When I see a senior, if they have children and grandchildren, 9 times out of 10, they are going to have the same problem that their parent had
Mm.
because foot issues are hereditary, just like your skin color or your nails or your hair. So your
Mhm.
foot issues are hereditary. The younger you start addressing them, the better off you will be. So I love what I do. I do it well according to my patients. I'm not perfect. Like I said, 90 to 95% of people, I realize you can't please everyone all the time, but I do my best. And I don't have a waiting list. So if you call me today, I might be able to see you today. It depends on when you want to be seen. I have a very friendly, open practice, and I look forward to hearing from you and seeing you in the near future.
That's wonderful. I can definitely sense the passion you have for the work you do. This was a real education for me and for our audience, I'm sure. It has been a pleasure, Dr. Andre, speaking with you today, learning about your practice and the services you provide. Thank you so much for the work you do, and we look forward to our continued partnership.
Thank you so much. God bless.